Hello viewers, I am Dr. P.K. Das, working as a senior consultant medical oncologist at Indraprastha Apollo Hospital. This is October, this is a month for the breast cancer awareness, and we should spread the message to our society, to all our young girls and ladies, so they should be aware about the breast cancer. We should not ignore. All over the world, out of all cancers, if you see one out of every four is person is having a breast cancer. So this is a treatable cancer. So how to go about it, and you should not ignore, and you have to see the body. The body is going to tell the answers. See, breast cancer, most of the time it starts as a painless lump. We should not ignore, and we should do regular checkups so that we can diagnose this disease very early. And these days, treatment has tremendous advances has been in terms of diagnosis, in terms of surgery, radiation techniques, targeted chemotherapy, immunotherapy has huge advances has been happened. And anyone viewers, they can ask questions. We can take a call according to their questions. We will try to answer them. Thank you. And the question is, what are the possible side effects and other downside of this treatment? So we're talking about the modern treatment in terms of whether you are giving chemotherapy or giving targeted treatment or giving hormonal treatment, depending on the type of medication or the immunotherapy, there are the side effects. So if you see the last decade back, the chemotherapy, which is the traditional side effects of the chemotherapy, like hair loss, loss of appetite, mouth ulcers, neutropenia, infections, that was a major issue. People are going away from the chemotherapy now. The targeted drugs in terms of good hormonal therapy or these drugs, there hardly any side effect on these terms of like chemotherapy. If you talk about immunotherapy, the side effect profile is very, very mild, can be manageable. And majority of these targeted drug and immunotherapy, they are the modern drugs. They don't cause a hair loss. There is no neutropenia, no infection, no immunity is going down or getting severe infections and all. So most of the time, whatever the targeted drug and immunotherapy, the newer drugs, they have a mild side effects which can be manageable. So depend. There's another question is Mr. Goel is asking what are the stages of cancer and what do they mean actually? The stage means where the cancer is located. Let's say, for example, if the disease is starting in the breast, so we call it as localized to the breast and stage one cancer. If the next step is if the cancer remain in the breast for quite a few times or few months or a year, they can travel to the first step is the armpit. That is called second stage. From the armpit is going to the mediastinal node, chest nodes, and the neck nodes makes it stage 3. Going to the other organs like nearby liver, lung, bone, brain. So that is a distant spread causes stage 4. As the stage advances, the outcome is definitely goes down. Most of the time, stage 1 and 2, the patient get cured with the localized surgery, chemotherapy, and radiotherapy. And once there is a stage 4 disease going to the multiple places, then you can't take the help of surgery. So then treatment is purely palliative to control the disease, to get the control of the disease for a few years or so. Another Muskan question, what are the chances of curing cancer? So many of the cancers are getting cured these days. So earlier the diagnosis, the outcome is very good. Few of the blood cancers, few of the leukemias, lymphomas, myelomas, and they are getting very good result out of the treatment. And majority of the solid tumors, whether it's a lung cancer, breast cancer, kidney cancer. They are the cancers and many other solid tumors, even ovarian cancer in stage 1 and 2, with a good modality surgery followed by the treatment as per the histopathology report. The patients are getting cured and living for decades. So nothing to worry that all cancers are not fatal. So most of the time we have to diagnose this cancer at early stage. Another most important is there a vaccine for cancer? Unfortunately, we have in a human body around 200 variety of cancer a person can have. Unfortunately or fortunately, majority of the cancers they don't have any virus etiology. Only cancer uterine cervix vaccine, which is there because of the uterine cervix cancer can happen because of recurrent infection due to human papilloma virus. So it is easier to develop a vaccine against a virus. So that's why the vaccine is there to take to prevent cancer cervix. If you take vaccines before a sexual exposure, cervix cancer vaccine, 3 doses, 97% there is a person is going to protected from cervical cancer. Unfortunately, many other cancers like hepatitis B induced or hepatitis C virus induced liver cancers, hardly any vaccines are there. Many other cancer, like as I said, 199 rest of the cancers, they don't have any virus etiology. So there is no vaccines. Another good question, Thanvi. Can we reduce the different cancers to a set of common traits? So it's difficult actually. Each and every cancer has a different etiology, risk factor, presentation. So there is a not a common trait or common kind of findings and all. You can't pinpoint. So let's say, for example, like mouth cancer. This is a global menace, particularly from the Indian perspective because of the tobacco chewing habit. So let's say the cancer is you are taking tobacco and are getting a mouth cancer. So we have to focus on the mouth and all. And person is having regular smoker, you can have a lung cancer or any problem in the throat. So depending on the areas, the cancer, the behavior and our different behavior varies. So we can't pinpoint a particular set of tests or particular sets of investigation for individual test. As a whole, we can do or do the investigation to pinpoint the different type of cancer. Another Latika Khan, his question is cancer is genetic? Yes, to some extent, yes. Few cancers are hereditary. We call it can transform from our either from the maternal side or paternal side. So, like the breast cancer and ovary cancer, they get transferred from mother to daughter. So if a person, a lady is having breast or ovarian cancer at a young age, so they used to have a genetic mutation called BRCA mutation, breast cancer related. If the mutation is there in the patient, almost 25 to 30% chance one of the daughter can have breast and ovarian cancer. Similar thing happened with a male patient with prostate cancer. If grandfather, father having prostate cancer, it can inherit to the sons. And to some extent colon, stomach, and pancreatic cancer has. But rest of the majority of the cancer, they are not genetic. Yes, does epigenetics play a role in cancer? In some cases, yes, not in all. Thank you, viewers.